Can you first confirm to us just how many nursing homes around the country now have links to coronavirus? Just how many cases are we talking about inside these facilities?
So all of the facilities that have an incidence of COVID-19 in them at the moment are in Victoria. The total number we have at this point is 54. Now, most of those relate only to staff members, but those that do have a considerable number of residents, and the number's now up to 170.
And so you would fear that those numbers would rise then, I presume, considering the nature of the virus?
Look, we're hoping to see it flatten off as the Victorians start to get the community spread under control, and the infections that we're seeing within residential aged care facilities are purely a function of that community transmission. We need to get that down. We need people in Victoria to work with us because this is the outcome of the community spread. Aged care workers, nurses in general health aren't immune from the virus. They will pick it up in the community as much as anyone else will. And unfortunately, some of them, without knowing it, I might add, are carrying it into these facilities, and we're now starting to see these infections. And you know, those numbers that I'm talking about have occurred over the last 2 weeks. Before 2 weeks ago, we were in a situation where we almost had no circumstance of COVID-19 in aged care facilities. We had a couple of sites that we had on watch that were going through final stages of isolation period, but in just 2 weeks now we've had a very, very concerning increase in the numbers as we're discussing.
Well, to have 54 facilities impacted, that's hugely worrying, of course, to residents and workers as well as residents' families, no doubt. Aged care providers are saying that they want to see any resident who tests positive to coronavirus to be transferred immediately to hospital. Why isn't that happening already?
Well, aged care residents who should be in hospital can and will go to hospital, but we need to make sure that we manage each resident in accordance with their actual clinical needs, but also their wishes. Most of the residents in aged care facilities will have a management plan that they are that includes their wishes. Some of them won't want to go to hospital. Some of them clinically won't need to go to hospital. We need to make sure that the capacity in the hospital system remains there to take those that genuinely need it, and those that genuinely need it should and will go to hospital.
But as the Aged Care Guild is pointing out, and I'm quoting here from the acting CEO, Nicholas Brown, he says these facilities are not set up for the level of isolation or acute care needed to manage a COVID-19 outbreak. He's arguing that they really should be taken to hospital straight away, considering the comorbidity situation, considering the vulnerability we know exists for our older Australians, to really try and nip that in the bud.
Well, some facilities aren't set up to meet that. And for example, Menrock in Essendon, where it was shared bedrooms, shared bathrooms, everyone in that facility has been taken to hospital because it wasn't possible to properly isolate the residents from each other, to cohort between the positives and negatives. And so for the safety of everyone, they've been taken out of the facility. But that's not the case in all aged care facilities. There is the capacity in most or a lot of them to isolate people effectively in their rooms where there's single bedrooms and single bathrooms. And what we've done in Victoria is, where a facility has required some space to be made to facilitate cohorting of residents or isolating of residents within the facilities, they have gone to hospital. The last figure I had, that of those who are positive, 65 were in hospital, and we've had to stand up a number of beds, particularly within the private hospital sector, to facilitate for that. And those who have genuinely needed it have gone to hospital. And I was talking to a provider this morning who's got a relatively large outbreak within their facility. They have quite a few residents who are currently in hospital because their clinical needs demanded it. But there's some that don't demand that level of clinical service. And so they've remained in the facility, and I think appropriately. And we need to make sure that we manage people in accordance with their clinical needs, making sure that they get the care that they require, but we also need to respect their wishes. And in some in some circumstances, the wishes of the residents are that they stay in the place that they live. And we need to remember this is where they live, and they do have some rights in that sense.
There has been some pushback from the Health Workers Union as to moves to limit aged care workers from moving between working in various facilities. I know workers in Victoria who are being stopped from doing that, going to their second or perhaps third jobs, are being offered cash payments to help them on that front. Would you like to see that become a blanket rule, though? Do you have any plans to mandate that to stop workers moving between aged care homes?
Look, I was in a conversation that involved that union yesterday where we were talking quite cooperatively and proactively with the unions. A number of unions were part of that conversation, and also some leading industry and sector players, to try and facilitate that outcome so that we could minimise the number of workers who are working across more than one site. You need to remember that this is about trying to prevent the spread of the COVID virus across and between facilities and into facilities in the first place. It is a complex task. I will concede that the union has a point there with respect to it being a complex task, but we need to be doing everything that we possibly can while there is the extent of community transmission that exists, particularly within Victoria right now, to minimise the chance of getting COVID-19 into these aged care facilities. We know how tragic it can be when it does get in, and so stopping it getting there in the first place is what we need to do, and we need to consider every single possible option that we have to do that. And we've been quite active as a government over a considerable period of time. We put 5 million masks into Victoria, announced 5 million masks for Victoria last week. 1.1 of those have already arrived in facilities so that every aged care worker in the state can wear a mask. We think that's one way to assist with the mitigation of the spread of the virus. And we need to put all of the options on the table. And so clearly...
And so just to clarify, Minister, is that still just an option that you mandate that no worker can go between facilities, or is that something that you have actually already declared as something that you need to be happening now?
We're trying to facilitate that happen cooperatively rather than mandating it. And so we're working with the sector, knowing how complex it is, so that they can work out the industrial relations arrangements between them, the unions and their workers. But we're very cognizant of the fact that we need to make sure that the workers aren't worse off financially. We're prepared to put some financial support on the table to assist with that, but we don't think it's desirable that it be a mandated process, but we're trying to facilitate for that to happen in a cooperative sense, and we're working, I think, well with the unions and the employers to see if we can make that happen. We need to make sure that we also maintain capacity in the workforce, because that is a significant issue with so many staff members who have contracted the virus or who are close contacts not being able to work. We need to maintain workforce capacity. So all of those things fold into this process.
Yeah, Aged Care Minister Richard Colbeck, appreciate you taking us through some of those issues, complex ones, as you point out. Best of luck with it. Thanks for your time.
Thanks very much, Ash.